Dr. Davidhizar, I have heard that some doctors are using Botox not only to get rid of wrinkles and look better, but actually that they are using it to get rid of headaches and even things such as sweating under the armpits. Is that true?
That's true. Actually, Botox has a lot of uses other than just for cosmetic purposes, and we use it in our practice quite a bit, actually. One of the common uses of it is, of course, for headaches. More and more people are using that. The nice part about it is it lasts a long time. It lasts 3 to 6 months, depending on what you're doing. And then the hope is, of course, if we can get those muscles settled down. What it does, of course, it blocks the nerve. It's a toxin, so it blocks the nerve impulses from that nerve, so it makes it, like paralyzed. And so it doesn't transmit pain. But lots of times the pain comes from a muscle spasm at the end of that nerve. So if we can stop that nerve from causing the muscle to be in spasm, if you can do that for 3 to 6 months at a time, that muscle will relax. And even when the medicine wears off, frequently the pain doesn't return because the muscle now is no longer in spasm. So that's been very beneficial to a lot of our patients. So we use that not only for headaches, but frequently for chronic muscle spasm in legs and other places as well. You're right about the excessive sweating under the arms. It blocks those glands as well. So there's quite a few places you can use it. And it's being used more and more in many different ways all the time.
Wow. So, it's not only to get a frozen face and,
no, it has a lot of other uses.
A lot of other uses. That's very interesting. So when you said it's like 4, 5, 6 months that it quite often does the trick, and because during that time you relaxed the muscles, it might even not come back, or much milder at least.
True. Actually depends. When we use Botox for cosmetic purposes, usually we tell people it's going to last about 3 months. But depending on what else we're treating, sometimes it lasts longer. And actually with the cosmetic use of it, if you get injections routinely every 3 months, usually after about 1.5 years, you don't need them near as often because the muscles, it's sort of like your body learns that it's not supposed to contract those muscles, and it sort of blocks the impulse. So it's amazing what your body can do if you sort of encourage it in the right way that you want.
Interesting.
So, but for most things, it's about 3 months for cosmetic. But other things, sometimes it lasts longer.
Well, I actually would have wanted to ask you the question, and you answered it. Is kind of, can you do the Botox, be it for the headache or be it for looking better, or be it for the sweating? Can you do it after it wears off? And you answered that yes, you can. And in fact, which is totally new to me, is you said that after you do it 2, 3, 4 times, whatever, anyway, several times, that the time it lasts, the time it works, becomes longer rather than shorter. Because many things, like if you take Tylenol, it works for 5 days, and then it works for 4 days, and then it works for half a day, and pretty soon it works for 10 minutes only. I'm probably exaggerating here. I personally haven't taken a Tylenol since my mom shoved it in me when I was 16. But so this actually, the body adjusts itself and says, oh, wait a minute, I feel pretty good not concentrating that muscle or whatever, and then keeps just not doing it anymore.
True. Eventually, kind of, just like if you have a problem with your one eye, you're seeing double. Eventually, your body will block out that one eye so you don't see double, and then eventually that one eye becomes essentially blind. So your body has ways of sort of making things work.
Wow, wonderful. And are you doing Botox for people who want to look better also, for that purpose?
Yes, we are. We do cosmetic Botox as well as for medical problems.
Okay, well, absolutely wonderful. All right. Thanks very much. Very, very interesting. Get rid of, so migraine and stuff like that, it works for those things, maybe?
It does.
Wow. Not just a little headache here and there, like migraine patients.
No, yeah. No, we wouldn't use it for just a little headache. It's got to be something kind of serious. Botox is kind of expensive, so you want to make sure the person really needs it. If there's some simpler way to get rid of it, we'd want to do the simpler way.
Right. Well, in fact, I might call up after this interview my sister and She's about 8 years younger than I, but boy, ever since I remember, she has migraines.
Those are the kind of people we treat with Botox.
Maybe she should try that, Absolutely.
I'd recommend it.
I'll definitely give her a call. Thank you very much.
You're welcome.